I'm going to do recording. This is our final exam today.
Mira, yes. Dáselo, papi. A ver si lo puede hacer en la computadora para no tener que ir para allá. No te puedo ir para Winter.
Exacto.
Si lo puede hacer en la computadora mejor.
Okay.
Ok, let me take this off. Déjame ponerte en grande para verte mejor. Pero me gusta esto porque te puedo ver. Y aquí.
Ah, yo no te puedo ver, yo tengo una sola pantalla. So, ya recording. Esto es el examen final de, no te veo que viendo tus chichis.
Es que tengo la cámara en el mismo medio. Ok, déjame
Okay.
ver. Déjame ver algo, espérate. Espérate.
I'm recording, niña, already.
Ahí. This is hot. Cuando tengo la computadora abierta, para mover el mouse, como que se... Ok, aquí está. Es la prueba. Ok, perfecto.
Ok, tengo que ponerte en cámara pequeña.
Oh, coffee. Coffee. ¿Quieres coffee?
No, thank you. Ya yo me desayuné con un bar. Ok, ahora sí. Empezamos entonces el examen de final exam o phlebotomy. No, este no es phlebotomy, este es PCT exam. Go to the page, please.
Ya estoy.
No, no te veo.
¿Cómo?
No. Mira,
¿Cómo que no te ve?
yo estoy viendo tu página y solamente estoy viendo la pantalla. Recuerda que tienes que irte a página a screen 1 para yo ver todo.
Espérate.
Solo estoy viendo la primera donde están los iconos.
Hello. Estoy abriendo la puerta.
Because I'm recording and doing it para que tú veas lo que estaba haciendo el otro día.
Ay, voy de aquí a abrir la puerta.
Un lío cuando está así, porque la pantalla como que no quiere como moverse bien. Cuando la telecomputadora está prendida. No, está bien.
Estoy abriendo.
No, todavía.
Estoy abriendo. I'm pulling your hair, tía.
¿Y ahora?
No, solo veo la primera pantalla. Tú tienes dos pantallas, una que no tiene nada, ¿cierto? Que
Sí.
está azul, esa es la que estoy viendo. La 10 y 8. Le diste ahorita es a la
Y ahí.
Ok, déjame ver una cosa. Did I make you? Yeah, you sharing everything.
Yo estoy sharing everything, so yo no entiendo.
No, tú estás sharing la segunda pantalla y dale a first screen.
Yo le di al first screen.
Ok, ¿dónde está? ¿Dónde tú tienes el examen?
Mira, voy a parar, mira. Share. Voy a comenzar a share.
¿Dónde tú tienes abierto el otro examen? ¿Lo tienes
Ahí,
abierto?
sí. Mira, voy a darle share. Le doy share. Le doy a la pantalla número 1. Es que si le doy la pantalla número 1, mira ahí.
Es la número 1 que tiene que darle.
Share. Ahí
Exacto. Bueno, ahí está enseñando nada más. Ok, dale entonces a dónde está
Ve.
¿Dónde está la website? Ok. Tú lo enseñaste ahorita.
Sí, ahorita me salió, pero ahora no me está
Dale,
saliendo.
dale a la otra pantalla. Dale, enseña la otra entonces. Tú le estás dando el número 1, enseña el número 2 entonces.
Hay una que dice enseñate, Rey.
Enseña la 3.
¿Está bien?
Ahí estoy viendo la que no tiene nada. La que está vacía. ¿Ok?
Y ahí
Ok, mira, ahí está, ajá. Exactamente.
la moví.
La mueve exactamente. All right. So,
Espérate.
estamos aquí en Final Exam, mi gente. I'm going to minimize you. Remember, Anna, we are recording podcast. I will minimize you. Bueno, this time, I will keep ourselves together. Let's keep ourselves here visible because this is our final. Can you see yourself? Let's start this recorder.
Ya, comencé.
I'm so excited, yeah? Let's do it. Oh my goodness. I'm nervous. Let me put the fan. Ya empecé a sudar.
Por eso yo que lo voy a coger, no tú.
It doesn't matter, sister. I get happy for you. I get excited for you. I cry for you.
Comencé.
Let's do it.
Okay.
Oh. Tu pantalla está muy chiquita. I can see nothing.
Yeah, I know. I can see too.
Okay. Yo voy a tener que poner esto chiquito. Yeah.
Two patient care technicians are transferring a patient who is this case from a bed to a morgue. To avoid injury, the technician should use which of the following body machine. Throw the patient gently from the bed to the gentle. Use a draw sheet to lift the patient.
I cannot hear you talking.
¿Tú le estás tirando el screenshot?
Sí.
A patient care technician is caring for a patient following the application of an immobility plan. Which of the following actions should the technician take to ensure the patient safe? Lower the bedside rail, raise the bed to the clinical working height, ensure the spleen remain moist, place the cold belt with the patient reach. A patient care technician is preparing to collect and transport a bilirubin blood specimen. The technician should use a tube that is which of the following color? Green. Patient care technician is caring for a patient who is 24-hour post-operative following a total hip arthroplasty and have a surgical wound. Which of the following findings should the technician identify as an indication of potential wound infection? Secondary draining, general discomfort of the incision, oral temperature, increased warmth around the incision site. Increased warmth incision site. Patient care technician is preparing to discontinue a patient peripheral IV. The technician assemble all the needle equipment and perform hand hygienic. Which of the following actions should the technician take next? Explain the procedure to the patient. Remove any O'Reilly tape. Turn the IV rolling clamp off. Apply pressure to the IV. Nope. Explain the procedure.
¿Qué tal si tú me dejas leer una de las preguntas y o tú lees la respuesta? ¿Qué tú crees?
No.
¿Eh?
No. Después tengo que leerla.
¿Pregunta o respuesta?
Yo leo la pregunta, tú lees la respuesta.
Ok.
Patient care, porque la pregunta es la que más necesito recordarme, recuérdate. Patient care initiates applying sequential compression device, ACD, to a patient who is postoperative. The clinician should identify that SSD are used to reduce the risk for which of the following condition?
Edema, deep vein thrombosis, varus vena, and pneumonitis.
This man. ¿Tú le estás tirando el screenshot?
Sí, después de ti.
Okay. Patient care clinician is caring for a 70 years old patient who have administered for malnutrition. The patient family manages his finances and grocery shopping for the patient. Which of the following hospital department should the clinician expect to inspect in this patient care?
Dietary, pastoral care, social worker, occupation therapy.
Okay. Recuérdate que es un examen. This is final. That's why I had to read it. Patient care clinician in a hospital setting is caring for a patient who has terminal cancer and standard. I need to live alone enough to see my child get married. The clinician should identify that the patient is in which of the following state agreed. Bargaining,
denial, acceptance, anger. Mira, yo no le he estado tirando foto a las respuestas que tú estás tomando.
No, porque no me va a dar la answer.
Okay. All right.
Ya tú tienes este.
Sí.
It's not different. A patient care clinician is performing post-moral care of a patient. Which of the following is a correct technique for preparation the body?
Removing any denture as soon as possible. Place the body in supine with one hand crossed above the other, ensuring all tubes dry. Bandages are removed. Place 4 towels under the head.
¿Qué fue?
Tú le diste de nuevo.
Oh.
Yo espero que tú que le dé y después yo le doy.
Okay. Patient care clinician is preparing to obtain a 12 EKG for a patient who have a left arm amputated. In which of the following locations should the clinician attend the arm lead?
Right extreme border on the impetus side, anterior axillary line, left torso.
Patient care clinician is caring for a patient who have a 2-piece colostomy system implant. In which of the following actions should the clinician take when providing a stomach care?
Applying pressure for 30 seconds when applying very wet. Cut the skin very wide to the tube 0.45 centimeters to the large of the stomach. Verify that stomach is moist. Direct the pink and color. Clean the skin around the stomach with a hot sponge water. Verify.
Apply pressure for 30 seconds when applying a skin resection. Patient care technician document in a patient electro health record. The technician should identify that which of the following abbreviation is on the Joint Commission approved leave abbreviation.
MPO, UIU, MGOS4.
PO. Entering a patient room and is appropriate apportioned by visitor requesting test result. Which of the following responsible by the technician is appropriate?
The doctor need to give the thing and the information, give you information. The lab value your all within the expected reference range. I am sorry, but I can give you that information. I asked the nurse to give that information.
Patient care technician is caring for a patient who is nonverbal. The technician should identify that which of the following findings can indicate that patient is experiencing pain.
Describe temperature, decrease pain temperature, redness, change in level of consciousness, dry skin.
Redness. This is my finding. 0.7. Pero dame que regresó.
A patient care technician is preparing to document information in a patient's electric health record and EHR. Which of the following actions should the technician plan take? Recording care before it provide. Note patient response to an analogical. Record the patient vital sign as reported to the nurse. Use analyze phrase when documented.
Record the patient vital sign report by.
Which of the following, okay.
Yo salté esa, o esa es. Okay. Which of the following reading is to represent?
Tómale un screenshot de nuevo a esa. Okay.
Represent. This one is
ectopic atria, tachycardia, wandering atria, pacemaker, atria, premature contraction, atrial fibrillation.
yes. Don't tell me.
No, it's not fibrillation. It's not.
Atrial premature contraction.
Yeah.
Yeah. Don't tell me which.
Okay.
Recuérdate que this is my final.
I know, I'm not telling you. Okay. Which of the following?
Which of the following findings should a patient care technician report to the nurse?
A 1-year-old patient who has pulse or rate of 15. A 1-year-old patient who has pulse or rate of 76 minutes. A 40-year-old patient who has pulse of rate of 88. A 80-year-old who has pulse of 85. After you.
Patient care technician is obtaining a patient a pickup pulse. The technician should measure this pulse in which of the following location: the first intercostal space, the fifth intercostal space, the seventh intercostal space, and the third intercostal fifth. When collecting a multi-drug venous sample, which of the following sites should the patient care technician attend to draw first?
Medicubicular, base, basilic, capillary radio.
Cuando la información y dice, no, Robert, cuando tú le das.
Continue.
No
A
tiene-
patient care technician is caring for a patient who has colon care.
Pero tú haces todo.
Which of the following findings should the technician expect? Blood in the stool, a small lymph node, weight gain in ingestions. A patient care technician is caring for a patient who have a colon cancer, Anna. Which of the following findings should the technician expect? Blood in the stool.
A patient care technician is
No le
caring for-
tiraste foto.
Mi amor, ve al supermercado. A patient care technician is caring for a patient who have an stomy. The technician should expect the fecal material to be more solid and less irritated to the skin. If the stomach is placed in which of the following location?
And the ileum and the secret colon and the gymnonium, Ana, lee la palabra, sigmonium colon and the synconium,
Yo la estoy leyendo.
syncom.
Bueno,
Oh, Joran, que se puso algo. Dale de nuevo. Screenshot. Okay.
patient care technician is performing a stomach care for a patient. Which of the following findings should the technician report to the nurse? The stomach.
The stomach has a small amount of the body drain. The stomach is red in color. The stomach is leaking around the water. The stomach is draining the side.
Which of the following provided a specific definition about the scope of practice for a patient care technician? The
Health Insurance Politician and Accountability Act of 1980, HIPAA, the Doctrine and Info Consent, the patient self-documented, a PSDA, the State Nurse Practice. ¿Qué es lo que dice la pregunta?
Okay, which of the following? ¿Cuál es el scope of practice?
Oh, definition about scope of practice of patient care technician.
Yeah, this the statin nurse practice ACTS.
Oh, no sabía eso.
Yeah. Which of the following
Screenshot. First
uh,
screenshot y después lee porque si no, no se te va a pasar.
which of the following device should a patient care technician use to help a patient maintain balance with begin weighing on a scale?
Walker, el elevation bar, can balance bar. Esta salió en el examen, tricky.
Walk. A patient care technician should report which of the following as possible elder abuse or negligence. A
A
patient
patient who refused to take prescribed medication. A patient who received phone call from family, but oh, se la sabe, yo no tengo que leer nada porque yo no he cogido examen. What
por
am I
eso que te
here?
estoy diciendo que yo
What am I here then?
mirando el
I'm
examen.
not learning anything.
Ya esto está, ya esto tú lo tienes, esta. ¿Oíste?
Lee.
Identify the reading in the tracing below.
Johnson,
tachycardia,
ventricular taquicardia, sinotaquicardia, acceleration, idioventricular taquicardia. ¿Te recuerdas que yo tengo siglos que no cojo un libro?
ventricular tachycardia. A patient care technician.
Dale el screenshot, mami.
Patient care technician is preparing to obtain a 12-lead EKG for a patient who is being evaluated for check-in in the emergency department? Which of the following actions should the technician take if the patient expressing fear of procedure? Advise
Advance the patient to the test is painless. Require the patient to remove all the clothing. Inform the patient the refusal is not an option to do that presenting symptoms. Causing the patient jewelry need to wear electron might cause pain. Spark.
spend. Technician is collecting a urinary specimen and accidentally spill into a floor. Which of the following actions should the technician take to clean a spill?
Use a clean dry towel. Use a disinfectant that contains bleach. Call the hazard dust material team. Use a mop with a hot soap and water.
The shoes to perform a capillary puncture is best determined by which of the following factor?
Patient weight, patient diagnosis, test result, test order.
Test result.
Bueno, sigue como tú estás haciéndolo. Hazlo como tú quieras, porque como tú tienes la hora simplemente. Keep going.
¿Qué le dio?
Le diste a pausa.
Oh.
Oíste. Toma tu examen rápido si quieres. Como tienes simplemente la hora.
A patient care clinician is assistant which the physical examination of a patient, which of the following identify should the technician use to verify the patient identification? Age, date of birth, phone number, and diagnostic. Date of birth.
Este da una hora, ¿no es verdad?
Este son las 2 horas, este de 2 horas. Porque
Okay,
son 120. A patient care technician should identify that the provider will stop a exercise stress test if a patient develops which of the following symptoms: myopathy, syncope, respiration, increased respiration rate, syncope.
Okay, you do it. Yo tomo la screenshot rápido.
Ok, porque esta ya tenemos este examen.
Pues sigue para que no se te vaya tu hora.
Okay, a patient care technician is performing a EKG for a patient who have a pacemaker. Which of the following controls should be used to ensure a accurate EKG? Lead electron, atrial filter. The atrial filter. A patient care technician is performing
Le tomaste el screenshot.
Perinatal care for a patient who is at risk for skin breaking down. Which of the following products should the technician use prevent skin breaking? Very creamy. ¿Tengo que leer todas las respuestas?
No, tú estás tomando el examen sola ya.
Ok. Vamos a ver cuántas malas saco. A patient care technician is preparing to perform a venipuncture for a patient. The patient is stating, I am pretty anxious about this sign. It's my first time having a blood draw. Which of the following actions should the technician take? Explain the reason to prevent prescription. Inform a patient about all position operation. Describe the process to the patient. Patient care technician is wearing gloves with assistance to inserting a urinary catheter. Which of the following part of the chain of infection is the technician interrupts plausible infection against infection agent. Patient care clinician should identify that which of the following readings should be reported to the nurse because it indicates that a patient might become unresponsive. Ventrícula taticardia. Ese es malísimo. La ventrícula taticardia te mata. Patient care clinician is reinforcing the teaching with a patient who have a hosted monitor. Which of the following statements should the technician make? Remove the wallet at bedtime. Take to bed in the shower. Avoid adjusting the electrode during the monitor period. That one. ¿Te le estás tirando los screenshots? ¿Tú estás haciendo otra cosa?
Estoy viendo que estoy estudiando el screenshot también, escuchándote.
Oh, which of the following actions should a patient care clinician take when preparing to transfer a patient from a bed to a stretcher? Elevate the bed to a position equal to the height of the stretcher. Elevate the bed to the position lower than, no. Evaluate, no. Is elevate equal to the height of the stretcher. Patient care clinician is lifting a box from a from a car into the patient room. Which of the following actions should the technician take to ensure properly body machine? Hold the box close to the body. Maintain a narrow base support. Bend at the wrist, no. Twist the torsion, no. Hold the box close to the body. Patient care clinician is caring for a patient who has right side heart failure. Which of the following findings should the technician expect? Hypertension, coloring, tachycardia, swelling of the leg. Swelling of the leg. Hinchazón en los pies. Patient care clinician is collecting a patient's pustune specimen. Eso es, el pustume es catarro, ¿oíste?
Sí.
Which of the following actions should the technician take? Ensure the patient to perform show call. Collect a minimum 5 steps, no. Have the patient use a alcohol, no. Obtain the specimen 4 times in the morning. Patient care technician is preparing to obtain and process a urine drug test for a patient. Which of the following actions should the technician plan to take? See the specimen leave with a label from the chain of custodia form. Check a specimen temperature. Nope, this one. Patient care technician is transferring a now weight bearing patient from the bed to the wheelchair. Which of the following actions should the technician take? Keep the bed at the most comfort working higher. Place hand under the patient arm to provide support. Lock the wheel of the bed and the wheelchair. Introduce the patient to remove socks. Introduce the patient to remove socks and nope. Lock the bed and the wheelchair. Para que no se vayan con todo.
Es lo más común.
Yo aquí veo esta parte que la repite demasiado. Is caring for a patient who is unavailable to avoid his bleeding and is crying in pain. Her attending provider have not yet made round and his primary nurse is unavailable. Which of the following action should the technician take? Immediately ensure the stray catheter to the nope. Report to the patient pin to the charging nurse. Have another, no, continue. Is caring for a new patient. The technician should recognize that which of the following procedure require medical assisted or cleaning technique, assisting to apply a straight dressing, insecting urina catheter in bed line, cleaning, okay. Changing backline. Which of the following is the most important action a patient care technician can take to help prevent the spread of infection? Wearing personal protection equipment, performing hygiene in between contact with patient, dispose of needle, performing hygiene. A patient care technician is performing an EKG for a patient, pediatric patient. In which of the following locations should the technician place be sick? On the arterial, on the madraxilla line. ¿Está conmigo?
Sí.
Patient care technician is using messaging to stimulate circulation for a patient who is immoving. Which of the following areas should the technician mention? Ahí abajo, está abajo del coso. The patient block, the patient lower leg, the patient lower leg. Sit down, is about to perform a vein punch for a patient. Which of the following equipment should the technician use to prevent hemolysis of the blood sample? A small volume tube with 21 gauge, a large. Tú sabes que está un poquito confundida, sorry. It's a large volume tube with 23 gauge butterfly.
Plancha. Ya, tírate. Ok. Ah, lenta es.
Se quedó. Is technician care is document a patient intake and output. Which of the following measurement should the technician include when recording output for a end of the sheet? Zero flow of one dressing, now some value. Solid two from the comments and total, no. A solid stool from the cousin.
Ya.
Technician is caring for a number of patients following a shift changing. Which of the following patients should the technician assist first? A patient who is disoriented. Technician is a long-term care facility. Is caring for a patient who requires restraining. For which of the following reason should a technician expect a provider to prescribe restraining? To prevent patients from injuring themselves and others. Technician is preparing to perform passive range of motion exercise on a patient knee. Which of the following type of exercise should the technician perform? Extension. Which of the following is a consequence of mislabeling a blood bank specimen? A transfer, a transfer reaction. Oops.
Oh, espera, tengo que tirarle de nuevo porque esta está. Y ahora sí.
¿La tiene?
Y ahora sí.
Which of the following can reduce a normal mark on an EKG tracing that are caused by facial movement or muscular trauma? Esa es. Come on. Come on. A patient care technician is performing a 12-lead EKG for a patient who have tachycardia. Which of the following paper speak settings should the technician expect they provided to describe? Esa es. Esa es 5. Yeah, 5.
Bueno, que you can review your answer con el video.
Pero, yeah, patient care technician, pero no me va a dar la ENSA, recuérdate. Patient care technician is assisting with the care of a patient who have diabetic mellitus. The technician should know that which of the following is a sign of hyperglycemia. Frequent urine. Patient care technician assisting with the care of patient who is on a stress INO. How often should the technician record the patient IO? Every 8 hours. Technician attended and in survey about performing CPR on a patient. When performing CPR, which of the following actions should the technician take? Is apply 100 to 120 compression for minute, following by 2 slow breath. Hay que mirarla bien, que son parecidas. Technician is caring for a patient who have a cerebrovascular accident and is now ambulatory. Which of the following findings should the technician report to the nurse immediately? A skin decoloration that submit with preparation, close of feeding on extremity. Okay, change in the size and shape of pressure ulcer. Technician is caring for a patient who is terminally healing. Which of the following actions should the technician take? Encourage the patient to remain optimistic about the diagnosis. No? evaluate the patient mental health.
Quedo pensando.
Eh?
No, que a veces se queda como pensando.
Yeah, which of the following is the purpose of using a standard precaution in the healthcare setting to ensure of health care worker receiving, okay, no, immunization to protect staff and patient from and to gather the patient understand information control that before enforcing, no. To reduce the transmission of blood-borne pathogen when providing patient care. Se me ha quedado en la cabeza. Which of the following blood specimens should a patient care technician keep chill during transfer to the laboratory? Ammonia. Yo me confundo a veces. Technician is preparing to perform a venipuncture for a patient who speaks different language than the technician. Which of the following actions should the technician take? Provide the patient with a professional translation. No, cerrame la puerta, por favor. Thank you. Siempre yo lo voy a tener que laquearla. Technician is caring for a patient who have an stage pancreatic cancer. ¿Qué tú estás haciendo? Cancer. The patient family is expressing concern because the patient have refused admission to the hospital program and is seeking additional medical treatment. Which of the following actions should the technician take? Encourage the patient to enter the hospital, tell a patient to refuse the treatment, no. Acknowledge the family consent and notify the nurse. Voy rápido, voy 66.
Ya, si yo voy después de ti, yo le tiro el screenshot después de ti.
Patient care technician is caring for a patient who have a prescription for antibiotic stocking. Which of the following actions should that technician take? About rolling the stocking partially down the patient left.
Me voy a dar una molestia, mija.
Patient care technician is caring for a patient and notice a fire in the western basket. Which of the following actions should the technician take? Close outdoor in the patient room, remove the patient.
Ve a la sala y tómate tu pílula.
Active the medicine. Remove, todo siempre remove.
Mucho. Esta fue, ven acá. Esta era nueva, ¿no? La que Lineri me acabó de entrar.
Sí, esta es nueva.
Ok.
A technician obtain a supreme specimen from a patient. The technician should expect the specimen to have which of the following characteristics. Cada vez que la leo esa me da asco. Watery consistency. Yo voy a cruzar todo lo que se cruza, que me salga el mismo examen, así. A patient care technician received a needle stick injury during a routine venipuncture. Which of the following actions should the technician take? First, report the incident to the supervisor, see provided for evaluation, wash the site with antimicrobial soap. Amelia.
¿El qué?
Si nos sale el examen así mismo.
Bueno, yo estoy chicharra, yo no estoy entendiendo mucho eso, yo tengo que volver a estudiar.
No, porque hasta que tú no lo repases, tú no lo vas a entender. Porque yo
Exacto.
hice lo que tú me enseñaste, por eso es.
Yeah, I'm a good teacher, not a good student.
Is preparing to, no está tan difícil este, Amelia. Al menos este no está tan difícil, el de X sí está más difícil. Is preparing to ambulate a patient who require the use of a game bell. Which of the following actions should the clinician take? Walk on the patient's strong side with ambulator. Walk slowly in the front of the patient with ambulator. Apply game bell of the patient close of the way rest. Yo lo que quiero terminar esto para ayudarte a hacer las cosas.
Yo estoy desde anoche, me quedé por la 21, fue haciendo el story guide de lo que tomé
Yo lo que
anoche.
quiero terminar esto para yo ayudarte. Yo me voy a llevar mi computadora y todas mis cosas para yo ayudarte ya también.
Ah, ¿tú estás loca? ¿Tú vienes a trabajar para acá?
Ya, pero yo te puedo ayudar también. So, puedo sacar ni que sea ahora un tiempo. A patient
Okay.
care clinician is assisting a patient to perform passive brain emotion exercise. Which of the following actions should the clinician take? Position the patient back and lower rest. Introduce the patient to flex his head. Place the patient in high-low position. Move the patient arm away from the body side. A veces tengo que ver la pregunta de nuevo.
Sí.
Se me ve el avión a veces. Patient care clinician should identify that
Tírate
which,
foto.
sí, should identify that which of the following patient require contact protection. A patient who have rutavirus. Yo pensaba que era tuberculosis, no, pero el patient who have rutavirus. Tanisha is assisting with the care of a patient who have activity in tuberculosis TB. Which of the following type of mask should the Tanisha wear when a patient is running? ¿A qué hora va Jamie para tu casa?
Ya no va a poder venir.
Oh, no? Okay.
Te cuento luego.
Is caring for a patient who has vision loss. Which of the following actions should the clinician take when assisting the patient with meal? Describe the location of the food and tray using a face clad reference. Patient courtesy is caring for a patient who is to yo le mandé, me hice la prueba de COVID ayer.
Good.
For a patient who is to receive continued tube feeding, the technician should place the patient info which of the following position. Okay, déjame leerla de nuevo. Patient que is caring for a patient who is to receive continued tube feeding. Okay, en supine position. Ay, yo aprendí de mi maestra, buscar las claves. Patient care technician is preparing to perform orina catheter for a female patient. Which of the following actions should the technician plan to take? Place the patient supine with the thin slowly adduct. So use a normal saline cleansing the mixture. Clean around the mixture with antiseptic solution. Take the cleanser catheter. Okay, I'm gonna let that know. Patient care technician is preparing to perform orina catheter care for a female. Oh, okay.
Patient.
Abre las patas. Patient care technician teach their glove, thread their glove with cleaning a solution matrix and get something on the cleaning solution on their hand. After cleaning their hand, which of the following actions should the technician take? C, medical attention, field work comparison claim. No, review the safety data sheet for the cleaning solution. Tanisha is preparing to dispose of a dressing that is heavy, solid, and leaking fluid. In which of the following locations should the Tanisha dispose of the dressing? And the view has it back. Patient care Tanisha in
Yo
a
espero tenerla toda. Yo creo que en la otra me faltaron algunas. ¿Y a ti te faltaron algunas?
Sí, pero yo te lo voy a mandar como yo lo tengo porque yo lo he arreglado. Yo te voy a mandar de nuevo lo que yo tengo porque yo lo he arreglado.
Okay.
Patient care Tanisha in a facility sustain a needle stick injury. Which of the following should the Tanisha notify following the incident? The nurse. Nurse, siempre la nurse. Por eso no quiero ser nurse. La nurse tiene demasiada responsabilidad.
Yes.
Is obtaining a blood specimen for a coagulation test. The Tanisha should select a tube that contain which of the following additive? Sodium citra. Patient que Tanisha receive a needle stick injury. The Tanisha should report this injury at which of the following time? Tú ves, no te confundas con esas preguntas, ¿viste? Son parecidas. Esa y la otra son parecidas. In the 7 hours before the staff, by the end of the documentation, before leaving the facility, at the end of the shift. Tú ves que dice injury también, dice de la cosa, pero aquí dice a qué hora. A clinician's planning care for a patient who is on contact precaution. When entering the patient room, the clinician should apply which of the following? Gown, because the contact precaution. Tanisha is introducing to measure a patient pulse manually. Which of the following actions should the Tanisha take? Locate the red arteria, feel the pulse with the inset and the middle finger. Find the pulse with feel 1 minute. Te estoy diciendo que si el examen me lo ponen así. A patient care Tanisha is performing on EKG and the patient report check pin and disconfort. Which of the following actions should the Tanisha take? Report the patient check electron, performing another EKG, notify to the provider. ¿Tú te fijas que no tiene muchas cosas de EKG?
No.
A patient care Tanisha obtain a stool specimen from a patient. Which of the following actions should the Tanisha take when labeling the specimen? Apply the label to the site of the specimen containing. Apply label to the leaf specimen. Apply label to seal into. A patient care Tanisha is teaching a newly hired technician about titanium endoscopic gastrostomy PPG tube. Which of the following statements should the Tanisha take? Esos son los tubos que se meten por ahí. Patients who are disoriented and confused are less likely to dispute, no? Patients who are receiving anti-nutrition via BP tube have an increased rate of aspiration. Se ahogan más rápido la gente que tiene el tubo.
Sí.
Patient care technician is assisting a nurse to set up set up suspicion equipment for a patient who have a tracheostomy. ¿Sabes lo que es eso? Tracheostomy. Ese es el cosa del estómago aquí, el abierto, el hoyo que tiene aquí.
Tú me estás
Which-
enseñando y yo estoy viendo nada.
¿Cómo así?
Yo no te estoy viendo, ¿tú sabías?
Oh, en el estómago aquí que te sacan ahí el intestino.
Ah, ok.
Which of the following actions should the technician take to maintain the sterility of the equipment? Place the packing drop under the tactical side. Use the dominant hand to trunk of the side machine. No. Use a clean glove to open the Suser cutter kit. Open the Suser cutter kit and then place it to the tip of the cutter towel. Patient care technician should recognize that which of the following scenario required accepted dressing change. Changing surgical wound dressing for a patient who is 1 day preserved. Cleaning a patient's strip lump cutter dressing. Cleaning a dressing for a patient who have a deep wound draining. Changing the dressing for a patient who have superficial cubicula. Technician is obtaining an EKG and notice that presence of a Wonderland baseline. Which of the following actions should the technician take? Move the patient bed away from the wall. Clean the patient's skin on the electrode with alcohol and gas. As the patient takes the breath, introduce it. Nope. ¿Qué tú estás leyendo?
Lo que está enfrente de mí.
¿A qué te veo para allá? Que Tanisha is caring for a
Yo no te
patient.
estoy viendo a ti, yo tengo la misma pantalla tan pequeña.
Oh, is caring for a patient who has COPD and is receiving oxygen therapy. The technician noted that the patient appearing reckless and is short of breath. Which of the following actions should the technician take? Notify immediately to the nurse. Technician is to perform a venous blood draw for a 91 years old patient. The technician should use which of the following method? Butterfly needle and syringe. Yes. Care technician have assisting a patient into bed. In which of the following location should the technician place the draining bag for a patient in indwelling urina catheter? Secure to the frame of the bed. Technician schedule hygienic care mission to be performed at the same time as other care measures. Which of the following terms best describe the technician action? Coordination of care. ¿Tú estás leyendo la pregunta o no?
Más o menos. Ahí porque va un poco rápido. Yo estoy tirando el screenshot. Recuérdate que yo leo más lento.
Oh.
I am taking the screenshot.
Yo
no estoy registrando mucho en mi cerebro.
Tanisha is preparing to disinfect a contaminated place of equipment. Which of the following action should the Tanisha take? Screw the equipment with bleach solution. rinse the equipment with warm water, process the equipment and soak the equipment with cold. So screw the equipment with bleach solution. Pero tiene que tratar de leer. ¡Ay, mira quién llegó!
Y pero qué lindo pusieron esos niños.
Está beidito.
Que lo lindo para hoy.
Perform a venipuncture for a patient
Ven de papi, vete.
anti-cubicular
Tranca la
area.
puerta, go.
Which of the
Ocho,
following
tres, cuatro.
version the initial insert the needle?
Close the door, bye.
O sea que esta pregunta me confunde. Ay, tengo hambre.
Porque la que la continúa. Tira esa. Ok, no, 96.
Ay, is preparing a technician is preparing a patient for hospital discharge. The patient stated, I am afraid to go back home to my apartment. Which of the following responsible by the technician is approved? Can you tell me if something happened that might you feel unsafe? Lo bueno cuando tú te familiarizas de la pregunta, que tú la miras tú ahí, cuando te dices, y una vez.
Sí.
Is caring for a group of older adults. The technician should recognize that which of the following type of injury poses the granted risk for accident death in the age group 4. O sea que fall. Si se cae se pueden matar, ¿tú no sabías?
Yes, it is 4.
Technician should identify the which of the following patient require droplet precaution. A patient who has influenza. Technician should identify that which of the following tasks require the use of sterile gloves. Remove an injury urina catheter, apply condo catheter, insecting a intermittent urina catheter. A nurse asks a patient care technician to empty a patient's stomach bag. The technician is unfamiliar with this stake. Which of the following action should the technician take? Ask for instruction from the nurse before attending the track.
We are in the 100.
Technician is measuring an adult patient blood pressure electronical. Which of the following readings should be reported to be the nurse? 98/60. Eso no es mal en nosotros. Mentira, yo vi ayer y mi precio estaba en 108 por ahí.
Me la reportan.
Patient care technician is ellos no reportan la presión de nosotros.
No, no reportan nada.
Is transporting a patient using a wheelchair. Which of the following actions should the technician take? Ensure the patient feet are placed on the footbread. Of course. Si no te jodiste, le va a llevar el pie. Technician is preparing to assist in performing an EKG for a toilet. Which of the following can be placed in mirror image to typical placement to prevent crowding of the electron? Leaf 3. Ese no se me va a olvidar nunca. Fíjate.
Todo depende.
Tanisha should recognize that which of the following statement regarding skin preparation for blood culture is correct. Okay, I will cleanse the area with gluconta. Tanisha should identify that which of the following action can create sharing, force, and impact skin integrity. Using a lift device to reposition a patient. Reposition a patient every 2 hours. Assisting a patient to the toilet frequently. Eso va a evitar que le dé irritación si tú lo llevas rápidamente.
Frecuentemente.
Ya.
No lo hacen.
No. Por eso que la mayoría de gente en el nursing home tienen infecciones, rash y toda esa vaina.
Yeah.
Clinicians should recognize that healthcare facilities are required by which of the following entity to keep safety data sheets as the SDS evaluate. OSHA. Yo pensaba que era eso, pero es OSHA. A technician over here, a nurse say to a patient who have continued impairment, I am so tired of you ringing the cowbell. The technician should identify that the nurse action violation the following part of patient bill right: the right to be free psychology abuse, the right of free of psychology abuse, the right to refuse treatment, the right to make action about pleasant care, the right to be free psychology, psychology.
Sí.
Tanisha is asked by a nurse to complete a take that is outside his scope of practice. After discussing his concept with the nurse, a feeling to come to a resolution. The technician should report his consent to which of the following individual: the attending provider, the charging nurse, the case managing nurse, another patient care, the charging nurse. Un hambre.
Ay, que no te desayunaste.
Which of the following organization provide, le dije a mi madre que me acompañe y no me lo estoy esperando todavía. Which of the following organization provided gathering for identify and prevent the spread of communicable disease? Okay. Let me see. Yo creo que es, espérate que no me acuerdo de esta, de una de las que, yo creo que es CDC. Yo creo que esa, not sure, I won't check. Una tengo que estar alguna, ¿verdad? Que not sure.
Pick one. Es mejor una que nada.
Tanisha is asked to leave a patient medical record on a designated area for a review. Which of the following actions should the Tanisha take to adhere to HIPAA regulation? Ensure that not identifiable patient information is visible. Yo no sé qué pasa conmigo, tengo la lengua medio traviesa. La boca seca.
Yo tengo agua aquí, quiero un poco.
Okay. The nation should identify that a bed scale should be used for a patient who has which of the following condition. Fracture ankle, about the knee amputated, a total hip dislocation. Yo pensaba que también podían poner a la gente que tiene una pierna amputada, pero no. Si tú tienes los hip amputation, te pesan en la cama.
Yeah.
Porque como no te puedes mover y con un pie así. Is caring for a patient who is, the nation is caring for a patient who is to undergo a blood transfusion. The technician should recognize that which of the following vital signs should be reported to nurse immediately. Temperature 101. ¿Hasta cuánto tiene que llegar el pulso?
El pulso.
Sí.
Bueno, a mí me sube hasta 80. Sí.
So Tanisha is preparing to open a stereo packet. Which of the following actions should the Tanisha take first? Perform a hand hygiene. Place the item in the center of the word circle. Patient que Tanisha is preparing, ya se lavó la mano, preparing to open the so place the item in the center of the word circle. Ya se lavó la mano, ¿viste? Porque ya está ready to open. Esa pregunta es media tricky, ¿viste?
Sí.
Tanisha is reinforcing teaching which a patient who is using a insecting experiment, which of the following statements should the Tanisha take? El experiment es esa vaina que la maga help forcing through the lung to raise the ball in the heaven. Remove a lump from the experiment and breathe them to Which of the following procedure step for a finger stick should a patient care technician do first? Clean the site with antiseptic. Confirm the identification of the patient. Tanisha is transferring a patient from the bed to the wheelchair. In which of the following position should the Tanisha stand during the transfer? Facing the patient. Me quedan 48 minutos. Tanisha is assisting a patient who is postoperative with deep breathing exercise. The Tanisha should recognize that the exercise can be prescribed for which of the following reasons? To prevent respiration complication. Clinician noted that a patient called his flu with ambulation and his bleeding. Which of the following actions should the clinician take? Apply straight pressure to the wound. Clinician should identify that adjusting a patient bed to be between 60 to 90, we place the patient in which of the following position? High flow. High flow. Attain drawing 6 vital of blood for a patient. A patient care technician find that 2 of the 6 vital are expire. Which of the following action should the technician take? Discard the expiration by
120.
Let's go see. Cross the fingers.
Use the fingers. I'm gonna put the camera. Now we can see each other. Let's see.
Oh my God.
Now
Now
take a deep breath, sit back and relax while we calculate your 85. So
Wow, mira, good job. Mira, for
go
AKG,
down, go down, go down. No puedo ver.
es
there you are.
screenshot eso. Ok. Patient care, 82. De 37, de 45 saqué 37. Ok. Completion, safety and performance respiration. De 20 saqué 18. Ok. Infection control de
Es que
11
ayuda más
saqué.
fue una mala.
Ya, dije una mala.
High five.
Y phlebotomy de 14 saqué 12.
¿No?
Sí, de phlebotomy.
Ah, ok, yo nada más estoy viendo, no estoy viendo el de donde dice topic, aquí en la parte del 2,
Ajá.
donde dice 1,
Entonces,
2, 1, 2, 11.
ya, ahora yo voy a chequear en cuál fue la que yo saqué mala. Me imagino que la misma que he sacado mala. Vamos a chequear aquí. Sí. Ok, obtain, record, monitor, and report vital sign. Estos son las 10 que yo he sacado la mala. Provide care for a patient who has a feeding tube. Take aspiration precaution or serve tubing for kind of blubbing. Provide basic patient care under the direction of nurse staff.
So, va bajándolo para abajo porque tú puedes volver para el video de nuevo. So, ve así el pasito para que pueda leerlo. Simplemente ábrelo todo.
Perform postal care.
Let me minimize this so you can see everything. Yeah, okay.
Communication with other healthcare. Perform a sterile technique. Ah, pero no me, yo quiero que me dé, tú sabes. Esto es estúpido. Deberían de darte la pregunta de una vez. Verify EKG machine paper speed. Ok. De 20, 25 to, ok. Te está dando la respuesta. Esa es la respuesta, será. Avoid a preliminary error when
Podemos comparar con el video. Poner el video en una pantalla y poner esto en otra pantalla. Y chequear si esa es la respuesta. So, asegúrate de que estén todas abiertas. ¿Están todas abiertas?
Ajá.
Ok, porque cuando se cierre el video ya tú no vas a poder volver para atrás. Dale begin. Ya eso es material.
Sí. Pero eso es a donde yo estoy, a donde yo, como estas son las que yo saqué mala. La
Okay.
11.
So, dale a bajar de nuevo entonces.
Ok, mira. Patient care. Estas son las de patient care. Estas son las que yo tengo malas. So, déjame bajarla. Oye, pensé que se había olvidado de mí. Tengo un hambre. Thank you. Me trajo hielos imperiles.
Limpié la cocina, limpié la sala. Espero que cuando vengan los terremotos, tú verás.
¿Y dónde están ellos? Va a tener que leer todavía.
Sí.
Porque estas son las malas que tú sacas. ¿Oíste?
Ujú.
Ok, este es patient. De esta saco una sola mala. Pero yo me conformo con eso. Mientras yo lo pase. Entonces, mira, aquí te di qué cosa. Este es el de Flavaron. Tú viste que no salen muchas cosas de Flavaron y de IKG.
No.
Salen más cosas ¿de dónde está? ¿Por qué no me sale? Este, no. ¿Qué no me sale? Ese no es de IKG, ¿dónde está? No me está saliendo de IKG. Ok. Mira tú.
Ujú. Esa es la máquina. Eso es lo que yo quiero saber también.
Ya, tengo que revisar esto. ¿Ve? Porque esto del SPI. Eso me confunde. Entonces, mírala aquí. What is the standard paper speed for EKG machine? 100? It's 20, it's 25. I know that. So I don't know. No entiendo. It's C, it's 25. Pero tú te confundes un poco entre esa y entre el SPI y la otra vaina.
Sí. So, ¿ya lo bajaste ya?
Ya, esa está baja ya. So close. Entonces, mira, tú, ya terminé, ya no me deja ir para ningún lado. Ya esos 40 pesos ya se gastó. Aquí dice track progress.
Ya están gastados. Ya
Ujú.
están gastados. ¿Ya no te deja tomarlo ya ni una vez más ya? Abusadores.
Este es el progreso.
Sí, vamos a ver el progreso completo, porque hoy es el final.
Ok. El atende uno.
32.
Ah, ok. Sí. Ok, ya cargaron. Este es el primero. Ah, regúlate que hubo uno que no lo hicimos. No puedes contar todo.
Sí, fue seguramente este.
Recuérdate que no, este lo leímos. ¿Te recuerdas?
Que no leímos, ¿será?
Que lo leímos. Este también. La que contamos ahí este también, pero esta no. ¿O sí? No me acuerdo cuál fue que estudiamos en realidad.
Ya, sigue bajando, baja.
El único que yo sé que leí bien fue este.
Ok, so.
No, mentira, ese y este. ¿Dónde está? Y el 5.
Las grabaciones están ahí, so tú te vas a dar cuenta. Lo grabamos todo.
Ya, el que yo sé que leí, que era el examen, era este.
El primero no sabíamos que era un tiempo.
¿Por qué dice en progress? Este dice complete, y este dice en progress. ¿Qué quiere decir?
No sé, mira, a ver, chequealo.
No me dice, ¿no?
Go back.
Poco review, déjame ver. Me manda para review.
Dale a lo que dicen que están en progress.
View report, me dice. Patient care, 45. Complication safety, empresa 20. Son 20 items, and the infection control son 11, tabaromy son 14 y que ellos son 10. Que ese hace el total de toda la pregunta.
Ok, so, sal de ahí ya. Para entonces para la, ¿ya? Stop sharing. Ya saliste.
A ver, si me sale
No.
así, yo estoy contenta.
And now we did it. This is the end of the recording. Hey, sister.
Yep.
Kisses.
Oíste, si me sale así, yo estoy contenta. Si me sale el examen así.
Ok, vamos para la grabación. Love you.
Párala.